Hey everyone, welcome back to the live stream. I am excited to be here for another awesome Saturday. Ask Me Anything, hanging out with Victoria, talking about medical coding, talking about healthcare, the medical industry just in general, and all of the great things that we've had going on. I am so excited to be back here today. Let me tell you though, last week during the live stream, I was talking about how I was finally going to actually take a day off. My plans thwarted. They canceled my day trip that I had planned, and I unfortunately was not able to get my day off yesterday that I wanted to go out and have some fun with my daughter. But I got some things done, managed to get some good stuff together. I'm really excited to be back here on Saturday for the live stream and hang out with you guys. If you are watching us on the replay, type hashtag replay in the comments. And now we are going to get started with the stream. Da, 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 da. I love the theme song. It gets me pumped up. So I'm excited to be here today. Boy, oh boy. I don't know if you guys have had a chance to watch some of the videos that I've put out over the past week or so, but it has been so wonderful to do some collaborations that I've been doing. I don't know if how you guys feel about the collaborations, but I am really enjoying them. Hey, welcome to everyone on that says, want to say hello to some people. Can't be so rude as to not say hello to Christina and to James and Manjoy and Marissa. Thank you for the super sticker. I appreciate that, Marissa. Actually, one of these days, Miss Marissa, thank you so much for that donation. I have to, when I get back into my YouTube, I'm actually going to make you a moderator because I think, and no pressure if you don't want to do it, but I think you would be good at just, if people are saying inappropriate things in the chat when you're hanging out, just kicking them for me. So yeah, thank you, Marissa. Great. I got your letter the other day, Marissa. I got to get back to you about that. Hello, Peru from India and Pooja. Good to see you here today on the live stream. So yeah, I've been doing some collaborations lately. I brought in Sam Lipolis, who talked about telehealth, and man, wasn't that Kyle interview? That was something else, right? Like he had such great insight on things that recruiters are looking for and things that I forget to even mention sometimes. Like I think I've even talked in the past about resumes and completely just went out of my head to mention, hey, when you put your name at the top of your resume, make sure that your credentials are behind there, right? So that was just so helpful, I think, to a lot of people. So I'm looking to do some more collaborations either through the recorded videos, because those recorded sessions are great, through the live stream, or even just through my podcast. So I'm going to be reaching out to some people. One thing I would love to do, and let me know if you guys kind of agree, is I would love to bring someone on that has made that transition from biller to coder, because I have so many people that are interested in coding because they already work in billing and are looking to make that transition. I'd love to talk with someone who's actually successfully done that, made that transition from billing to coding, and how that went for them. So, Hayla Morgan, it says that you just finished your first part of the CPC exam. So are you doing both parts today? Or are you doing them separate? Like, are you going to do like a Saturday and a Sunday? I know a lot of people seem to like to just kind of give themselves like an hour or two break, it seems like, in the middle, and then take both of them. So hats off to you. It's even just taking it at home and doing it virtually, like it's still a lot to do, right? I wonder if that super sticker from Marissa is from last time, because I think, you know what, that's funny. I think that might be a delayed super sticker from last live stream, because she came in, I think, at the end of last live stream with a super sticker. Speaking of collabs, before I get into some of the questions, I don't know if you guys saw this yet. If you are on LinkedIn, connect with me on LinkedIn, Victoria Moll, or you can connect with my business, Contempo Coding, and there is information there. I am doing a free webinar with Gentum Health on Tuesday at, let me check the time, I believe it's 12 o'clock Eastern Standard Time. and it's on diagnosis coding. I'm covering some of the that is from today, Marissa, but I'm covering some of the most expensive diagnosis code errors and then how to fix them. So it's just going to go over diagnosis coding stuff. There's probably going to be a lot of physicians in attendance as well. So I'm looking forward to doing that presentation. If you guys could let me know, and because I'm going back to my old setting that I didn't have last week, where I'm filtering through a couple of different channels with my video. So if you could let me know if my audio video is syncing correctly right now, and if my audio video sounds okay, I would just really appreciate just a thumbs up or you sound good or everything's okay, Victoria. Marissa, so yeah, thanks for the super sticker. Again, I'm just so happy to see you in here every week. So I have a question here from Sierra. I started chapter 1 training with the AAPC self-guided. I feel so lost. Advice maybe should go to instructor led. Yeah, so I don't know if AAPC lets you go through instructor led. If not, some people have, I think, experienced that too, that they've gone through the self-led and then once they've gotten into it, went, oh gosh, you know what? Kind of would like to change my mind. So that might be worth a call to the AAPC if it's something that you think you're going to need some more instructor led, that you could see if they'll let you switch. If not, there are tutoring options out there. Maybe if you're just having particular areas that you need some assistance with, like there's tutors.com and there's also wyzant.com, wyzant.com. And you can find tutors available there. There's also sometimes support groups that you can find on Facebook that might be able to help you out. But if you're continuing to struggle, yeah, I would say maybe contact the AAPC and see if there's something that they can guide you with if you're able to switch over to the instructor-led courses. Lucy says, hey, I started my first class last week. I have been watching your videos all week. You are great at these videos and I'm learning so much. Well, thank you, Lucy. I appreciate that. Yeah, so one of the things I'm concentrating on now, and I'm not doing them every week because it's hard to just get a lot of the content together, but I'm doing kind of chapter specific videos where I'm going through into integumentary, I'm going through cardiovascular. Next is digestive. I actually am thinking if I want to put a little heme lymph portion in there. I think the curriculum that they have for the CPC in particular doesn't go a lot into heme lymph. Like there's not a heme lymph chapter. They kind of bundle it in with cardiovascular. So I might do like a mini heme lymph and then also do digestive on top of that. But I'm looking forward to digestive because I'm really good with the digestive coding because that's all of our stomach procedures. And I've done some hernia repairs. I think they're in the digestive system as well. So that's a good one to go over. Jamie's asking, am I going to do a video on E&M? So I have a couple of videos on E&M. So let me show you. Actually, I think I have a playlist on the channel itself on E&M, like everything I've put together so far, but I am planning on doing some more E&M specific stuff. So let's take a look at what's on here now. So channel, if we switch over here, there is, I believe, a playlist here. If you go to the main channel page, down here, there's a whole playlist on E&M coding. Now, this is one I recorded this series in 2002. So this won't cover the new E&M concepts, the 99202 through 99215 new guidelines. I think I do cover that in a different video, though, that some of the updates and revisions. But this is all I have on E&M. So what I'm doing right now, and this is taking a little bit of time to put together, but I'm hoping to get it out by the end of this month, is I talked about how I want to do a video where it's just me coding E&M for an hour, just a menagerie of different E&M stuff. So not just stuff that we level, but also like a physical exam, a discharge, an observation, an inpatient, outpatient. And I'd love to just do like, literally just call it like, this is like I coded E&M for an hour and just an hour of me coding different cases, because I've even heard feedback that people are like, oh, well, I'm interested in doing maybe hospitalist coding. And they want to know how to code the visits for hospitalists. So inpatient visits, the initial, subsequent sequela, or differentiating those between the initial, subsequent sequela. Oh my God. Initial and subsequent and discharge. And also observation coding, and then some more inpatient E&M stuff. Now, the other thing to keep in mind, though, is if you watched, the AMA had a presentation they did a few weeks ago on the E&M updates about the technical corrections they did. And one of the things that they mentioned during the technical corrections webinar is that they are looking at changing, it seems like, the rest of evaluation and management in 2023. So right now we have these new guidelines for our office outpatient visits, and it sounds like they're going to tweak the rest of them for 2023. So like our skilled nursing facility, our inpatient, our observation, all the other leveled E&Ms, those are likely to change now in 2023. Unless, of course, something would happen that would get pushed back. But it sounds like that's the AMA's target, that they want to change the rest of the E&M levels for history exam, medical decision making, and change it over to something else in 2023. I don't think it will be exactly the same as what we're seeing now, but I imagine there's going to be a lot of similarities with the new E&M grid. So for those of you that are kind of students and maybe don't know what I'm talking about with the E&Ms, I'll show you quick. So if we look at our E&M codes for our office or outpatient visits. So that would be something like if you're going to see your doctor or your specialist in the office. We code them based off of different components of medical decision-making and just medical decision-making. So it is the combination of the number and complexity of problems addressed at the encounter, amount of complexity of data, and then the risk of the patient. And that's how we calculate those. So if you kind of look at the code descriptions themselves, it's based off of, let's see if we can zoom that in or get that a little bit clearer. These visits are based off of if it's new or established, and then the level of medical decision making. So low medical decision making, this one is moderate, high level decision making. And this is just medical decision making. But some of the other E&M codes, like for example, our observation codes here. So a patient's being admitted to the hospital for observation, they're based on different components. They're based on a history and an exam and medical decision making. So they're looking at 2023 as maybe reevaluating this. They will likely do the same, I'm thinking. Oh, look at my camera's all funny. They're likely, I'm thinking, going to do the same as the office outpatients and just base them on medical decision making. But we won't know until we see it more closer to 2023. Hopefully it'll be well in advance so that we have time to prepare, right? Jamie says, you do a wonderful job. I have learned so much from your videos. Thank you, Jamie. I really appreciate that compliment. Let's see, our Prasad, can we bill C9803 from lab for Medicare? That one I don't know off the top of my head. If you're interested in getting something further on that, I would probably have to, it would probably take some time, and I would have to charge you consultant fees because that's something I don't know off the top of my head. I would have to research into it. So let me see, Claudia is in here. I currently have my CPC certification. Awesome. Excellent certification, probably one of the most popular medical coding certifications out there. Would you recommend me to go for the CGCS certificate? And now, if I remember correctly, is that one of the AAPC's general surgery coder? Yeah. So if you're interested in general surgery, I think that would be great. If you're working in general surgery, I think it will definitely demonstrate some proficiency. I personally have worked general surgery in the past. I like general surgery. I like doing the lipomas. I like doing the hernia repairs, the cholecystectomies, the appendectomies. I've worked with general surgeons that have done mastectomies in the past. So I love general surgery. I find it very fascinating. And if you don't like E&M at all, which some people don't, and I certainly can't blame anyone for that, getting into a surgical specialty would be phenomenal. So I think there's great ways you can study for that. If you're interested in general surgery or even any of the specialty certifications that the AAPC has, I would suggest study guides and practice exams at a minimum. I think they do offer some specialty modules you can go through now, but I think if you already have your CPC, just working through practice examinations and study guides is probably going to be the best bet for you. Um, I think, I think, you know, as far as practice exams, which I do believe they have specialty practice exams, I usually say aim for about an 80%. If you're getting 80%, that's a good indication you'll likely get at least a 70 when you're taking the in-person exam. Um, and keep in mind also, right now, we're kind of still in a moment where it's might be hard to schedule a exam in your area. So kind of take a look too at exam availability in your area, if there's exams available that you can test. And if there's not a lot by the end of the year, like if you're planning on testing in November or December and they only have 2 seats open, you might have to weigh, do I want to book those now or do I want to wait and risk the fact that maybe, I might not be able to get in somewhere for a while. So some other things to consider there. Marcy, I failed my first exam attempt of the CPC exam by 4%. Bummer. So I'm scared to schedule my second attempt. Your videos are fantastic and I'm going to binge. Thank you very much. Wish me luck. You know what? The great thing though is I always say if you're pretty close, if you're only a few percentages away, you only have to fine tune a few things. And chances are good that now when you go for that second attempt, you're going to like nail it because you know exactly what you're going to be expecting. You know the flow. You kind of have your time management down. So I bet any money that once you fine tune some things, go in and go for that second attempt. You're going to be so grateful because your score will be like infinitely better, infinitely better. But yeah, I appreciate that. And I'm glad if there's any other suggestions that you guys have as far as videos, I am always open to suggestions. But I think I coded E&M for an hour is going to be fun watching me just code E&M. It's a tough thing though, because, with E&M being so subjective sometimes with some coder saying, hey, can you code it this way? I would have drawn this out. I would have coded this way, or well, I would have counted this or circled it this way. It's intimidating sometimes to put out so publicly E&M cases that I've coded because the questions that come in sometimes it's like, oh my gosh, well, yeah, you could have done it that way. Would we have come up with the same code? Yes. So it's odd sometimes. It feels a little bit vulnerable putting your entire thought process of how you do E&Ms out there. Next question I have here from Jamie King. Hello, Jamie King. How is the CPB and CRC? I have my CPCA. I'm looking to get another certification. Not really sure which one I want to do. I was thinking the CPB or CRC. So there's a couple of considerations. First, I would say, are you already working in revenue cycle? Because if you have your CPCA, but you're still having trouble finding a job, I think the CPB will help you cast a wider net. You'll be more marketable throughout the entire revenue cycle, the entire billing system. Healthcare organizations will look for you a little bit more because you'll have a wider variety of talents. You could do billing or coding. So if you're not in a position yet, I would suggest to go for your CPB. If you're already in a revenue cycle or in coding and you're looking to maybe expand your coding knowledge, then I would go for the CRC. The CRC is really starting to grow in popularity. It's actually the AAPC's second most popular credential right now because of just how big risk adjustment is. Of course, I would love if you go for your CRC that you would take my course because I do have one available on demand. So that is there on my website, contempocoding.com. I can actually show it to you right now. I'll take it over. I have had 100% pass rate with all of my students so far on it. So if you go to contempocoding.com under the courses section, you can find here, there is my risk adjustment coding course. And thank you to Comfort Montgomery for subscribing to the channel. I really appreciate your support. So that course I make available, you can get it at any time, take it on your own pace. There's no time limit on it. So there's no time limit as far as you have 3 months, 6 months, etc. It is just genuinely as long as you need to have access to the course. Now, if you think you can self-study, that's fine too. The other thing to consider is if you want to self-study through the CRC, you're like, I think I can just get the study guide and some practice exams and figure it out myself. I actually have some options for that as well on the website. So I have a CRC review and practice exam if that's something you're interested in. Again, I know some people have preferred vendors, so I have no hard feelings if you want to study through something else. Hi, Faraz. Hey, good to see you in here today. Welcome back to the live stream. Yeah, so Jamie, yeah, if you're having a hard time finding your job, I would consider the CPB. And one of the things that I was talking about the other day in one of my videos about, I think, credentials, is one of the tricks I found because people ask me about, oh, well, is this credential worth it? Is this credential worth it? Is this credential worth it? If you go into like Indeed.com, where you can search what employers are looking for, not just based on job title, but skills or certifications, I know that if I type CPB in here, that it's going to come up with billing jobs, that these are billing jobs that are looking for someone to have that CPB certification. So if you're ever not sure about a certain certification and if people are actually looking for it, if it's worthwhile from that aspect, you can just type it into Indeed.com here. Like if I were just to type in some random string of letters, nothing would come up because there would be no one looking for that certain credential or string of letters, what have you. Now, of course, you might just want those additional credentials behind your name or think that in the long run, it might be worth it. I'm never going to tell anyone not to pursue a certain credential or go through a certain organization. But if you're looking for, is this going to make me marketable as a medical coder? That's a good way to tell. Go into Indeed.com, type in that credential, see if anyone's actually looking for it in their job descriptions. Oneida, is 2 months good enough to study for the CPC exam? That kind of depends on where you're at. So I would say if you're someone who's in healthcare, you're like a medical assistant or an RN, or you're working in billing or somewhere in the revenue cycle or pre-authorizations, and you have an understanding of insurance and you know MedTerm and pharmacology, you could probably bang out your CPC and be ready in 2 months. But if you're someone who's coming in from a completely different industry, that you're in textile manufacturing or farming or retail, and you don't know MedTerm and you don't know much about insurance, 2 months is probably going to be a tighter fit to learn all of that stuff before then. So yeah, Oneida, if you're already a CPB, I would say 2 months, that's definitely a reasonable target to hit for your CPC. Just make sure you break it down into manageable chunks. Say, you have, I can't remember off the top of my head how many chapters the CPC curriculum is. I want to say 22, but I might be thinking of how many chapters there are in ICD-10. But then break them down and say, okay, well, these are, if in this 2 month span, these are how many chapters I need to finish each week, and just break it down and make some goals for yourself that way. Speaking of goals, I am like a hair away from hitting 25,000 subscribers. Can you guys believe that? That means I am a quarter of the way to getting a silver play button for YouTube, which, if you don't know, is a huge YouTube thing where YouTube sends you this big like plaque and it's silver and it has this play button on it. And you hit that when you get 100,000 subscribers. Statistically, I'll hit it in 2 to 3 years. But 25,000 is a pretty big landmark, and I'm excited about that. So what I'm thinking about doing is maybe next weekend for the stream, having a giveaway. I found out that there's some software that I have where I can possibly do some prizes and giveaways that it can make it really interactive and easy, and maybe do even just like a coding game. Nothing too complicated where we're coding surgeries, of course, but maybe some things like about the appendices of ICD-10-CM, or maybe even just a little bit of trivia. And I thought that would be a fun thing for next weekend to maybe give some stuff away. I don't know what I want to give away yet, because the first thing that comes to mind is, give away coding books. But if you already have coding books, that's not really much of a giveaway. So maybe I'll do like an Amazon gift card or something. If anyone has any really good ideas of a cool giveaway, maybe some t-shirts or something, I could give away some free, that's a great idea. I could give away some free t-shirts, maybe even a free course or something. I'll have to think about it. But I think that would be fun if next week we did some prizes and giveaways. I'm not going to dress up like a pirate again, but we could do some pirate giveaways. We're going to do some giveaways and prizes. Oh my gosh, look at that. Speaking of pirates, the Pirates of Shangaloo are here. As a medical coder and biller, do you enjoy knowing that you are killing poor people and bankrupting hardworking Americans? So that is a great question. So I don't set the bills for these people in the United States. So that really is dictated by the fee schedules by the healthcare organizations. So as a biller and coder, I actually am very proud of the fact that we try to reduce the costs of healthcare in America because we're trying to make things more compliant. We want these insurance companies to pay for services when they are due. I would not say I'm personally killing poor people and bankrupting hard Americans. That is really a very high level corporate decision. That is not anything that the biller or coder has control of. So I wouldn't say so. No, not at all. Yeah, Marcy says t-shirts. Yeah. Appreciate that. So yeah. So, I definitely respect the fact that healthcare bankruptcy is one of the number one causes of bankruptcy in the United States. But yeah, so appreciate that question though. So coding outpatient ortho is that if there there is an infection caused by internal hardware, would you give that an S seventh character for sequela? Thanks. So there should be, I believe, a code for, let me think this out. For, oh gosh, not malfunction. Yeah, Paula, that pirates thing kind of threw me for a loop there for a second, and now I'm trying to think. It wouldn't be considered a sequela. It would be considered almost like a malfunction code. I can't, for whatever reason, think of it off the top of my head, but there should be a code for a I don't think it would be a sequela, because a sequela would be more like the fracture did not heal appropriately, but more so that it is having a malfunction type of the hardware. And then, of course, you would also code for the infection if you know the type of infection. So I have a question here. I failed my CPC exam in the first attempt. I'm very scared to retake the exam. Kindly tell me how to manage the time during the exam. So my thought would be focus on what you struggled with. So look at the areas where maybe you have the breakdown. If it was something maybe in surgical, if it was something with ICD, and pinpoint those areas where you struggled. Go back into your curriculum. So be it digestive, be it cardiovascular, look at those specific sections and focus on those and retest, restudy, reread your chapters on those, and do your questions on them. So for example, if you have like the CPC curriculum, let me grab it. All right. So depending on what books you have, you can, if you have the step-by-step books, if you're working with those, go back to those specific chapters based off of where you had those deficiencies on the exam. Read those again, study those, do the practice, read the chapters again. If you're in the AAPC CPC curriculum, do the same thing. Go through your chapter guide again. And if you were having trouble with, for example, endocrine and nervous, go through that chapter, read through those. There's practice questions in these as well. Go through those again for sure. My stack of books here. This is my anatomy coloring book. I don't know if you guys have ever seen one of these before, but this is my anatomy coloring book. I really enjoy the anatomy coloring book, but I never seem to get to it as much as I would like. But this is a fun way, I think, to learn anatomy. Where can I find these books? So I have a link in most of my comments on YouTube, or most of my video descriptions on YouTube, of my book recommendations. Otherwise, if you're interested, I have, and you know what? I should have included the coloring book in this. I don't know why I didn't think about this, but I have a video of all of my book recommendations on YouTube. And then just to include, like they are affiliate links. So if you click on them, you decide to purchase the book, it'll cost you exactly the same, but then I get a small percentage from Amazon or wherever I'm referring you to. But if you go over to the channel, you can see here, I have a video on book recommendations, right? Medical coding review. Oh my gosh. Was it that far back that I can't even see it right now? Let's go back to the videos. And let's see here. Book recommendations. Here it is. Medical coding books for 2021. That's where I have all of my best medical coding book recommendations. Yeah, you know what? That's a great idea. I should do a giveaway of the anatomy coloring book. That's what I'll do. I'll give some t-shirts and I'll give like an anatomy coloring book because that's probably not one everyone has, right? So that'll be a couple of fun things to do a giveaway of. Absolutely. Yeah, next week will be a great time for giveaways. Hey there, NC worker. Welcome to the live stream. Great to have you here. I love seeing it actually shows me the numbers that are in here. So I kind of see everyone popping in and out as you're going. By the way, if you appreciate my content and you like it, you can also join channel membership. What I do for my channel members is there's a monthly fee you can pay. It's anywhere from $1.99 to $9.99, depending on how much you're willing to contribute to supporting the channel. $1.99 a tier, you get custom emojis, you get community only posts. Coffee mugs would be a good one too. You're right, Patty Tucker. I do have some coffee mugs. And at the $4.99 tier, you also get access to have your name added to my end credits for my videos. $9.99, you get that as well. But at the $9.99 level, you also get some exclusive videos, sometimes behind the scenes, sometimes they're outtakes videos. And yeah, so that's what I offer to the membership. So if you're interested in joining, there is a little button at the usually it's at the bottom right that says join, if you'd like to join channel membership and support the channel. If you want to support the channel in other ways, the other way you can support the channel is I do have merchandise available. If you're on YouTube, it usually displays like right at the bottom here. So you can check right at the bottom underneath where the ticker's going now. And you can check out there. I have some t-shirts and merchandise and masks and coffee mugs and all kinds of stuff available. Polyneer says, color and coding and coffee. That would be, you know what would be even better than that? So I've noticed there's a couple of people now, and I've even seen some chapters have this in the past, coffee and coding sessions. But you know what would be better than coffee and coding? Would be cocktails and coding, right? Because if it's not like a chapter event, we don't have to worry about the alcohol for it, right? Because it's not a sponsored event. You're not allowed to have it at like official coding stuff, but I think a live stream we could do cocktails and coding, right? Like switch the stream to like 9 o'clock on Saturday. Carrie's asking, I have a question. Is it illegal to build bundled codes together per the NCCI? Well, if they're one that are very clear that you should not be billing these together, that if you look in maybe the NCCI edit policy manual and it says in these circumstances, do not bill these together, and you knowingly bill them together, it can be illegal. So really the difference between fraud and abuse is a little bit kind of the intent. So abuse is like, oh my gosh, we didn't realize there was an NCCI edit manual. We accidentally billed this out to insurance. You know, we're going to pay it back. Don't worry. So that's abuse. Fraud is it's actually gone through the court system. They've recognized that they were intentionally billing things incorrectly. And fraud has to be kind of proven in the court of law. So that's more fraud, and that is definitely illegal. Now, both, I guess, technically are illegal. One's just a little bit more less malintended, I guess, than the other. But yeah, I mean, there are some instances where you can unbundle things. So is it illegal to intentionally bundle things that should be bundled together? Kind of, yeah. Yeah, Priyanka has a good point here. So if you guys are struggling with the long questions, having different multiple code options, simply go with the first sequencing of all the options A, B, C, and D. Yeah, one of the things that I stress upon with the CPC exam, which is all multiple choice, definitely look at those answers first before you go ahead and try and read 2 or 3 pages of a note and figure out like what is it I'm trying to do here, like what is important, what's not important. Like look at the question, look at the answers, and then piece it together from there, and then go back and scan through, versus trying to like read through a 2-page note and go, what the heck am I looking for here? So Barb's saying, yes, need more info on how to interview the question without stumbling. Are you talking about like interview questions? Like if you're interviewing for a job, let me know. Because I can definitely get some more interview specific stuff. Because I've noticed there is a high search volume for medical coding job interview stuff. Can I do more video on the answers first method? Yeah. So that might be a good idea. So I'm doing a lot of videos on chapter specific stuff, but just maybe focusing in on that concept, like looking at the answers first and then piecing together. That might be a good idea too, just to go over just that isolated discussion on that method. Kit says, I am 2 months into my certification course. I am enjoying it so far. That's great. I mean, that's really the important thing with medical coding, is that you enjoy it, right? Like so many people, I think, in the past at least, and maybe not so much because there are so many more job options opening up where you can work from home. But there's just been this focus in the past that people are like, well, I want to get into medical coding because I want to work from home. Well, that's great. I think that's a perfect goal. But you also have to enjoy it, right? Because it's no fun working from home if you're like, this is the worst thing and I don't like what I'm doing. So it's always just so great when you take that leap, you make that decision, you go, you know what, I think this is something I'm going to enjoy, and I definitely want some of the perks that are associated with it, good pay, potentially working from home. And then you get into it and you're like, yeah, I'm really enjoying this, I find this fascinating. So that's great. I'm happy for you. Janelle, do you think A and P course is necessary to pass the CPC exam? If not, what do you suggest me knowing to pass? I think it's possible to get through the CPC exam without knowing a depth of A and P. I think medical terminology is absolutely a must, though. So I would definitely make sure that you learn medical terminology at a very minimum. A and P, you could probably get through without an A and P course. Some of the concepts that they might test you on, you could probably piece together even through just some of the resources that you have in your book. So, for example, they like to sometimes question you on the blood flow of the heart. Well, there's an illustration in the cardiovascular section of CPT in the table of contents that shows you the blood flow of the heart. So as long as you know that that illustration is there, if they ask you a question, you can reference it. But if you're not familiar enough with your book and you don't realize that's there, then you're thinking, oh, I got to memorize the blood flow of the heart. I've seen some people that will write the entire thing out on a totally separate page, not realizing that that illustration is right there for you. So I would say, if you don't at least know med term, there's a book I recommend, and that's on my book recommendations as well. I'm not sure if I have it in the video, but it's called Medical Terminology and Anatomy for Coders. That is a great book. Definitely check that one out. I usually have it linked. Do I have it here? I don't have it here in my current pile of books. Is this it down here? Hold on. So if you don't want to take a whole course, this is an excellent alternative. Medical Terminology and Anatomy for Coding. There's a 4th edition now. I would suggest the 4th edition. I think you can get the 3rd edition, which is maybe slightly different, and it's maybe $10 or $15 cheaper to get the 3rd edition. But if you can, get the 4th edition. And I love this book so much, and I'm even going to give you a little sneaky preview of it. So what I can show you about this book that I think is just so helpful is, let's see if I can find a good page of this. Okay. So like on this page here, they're talking about AMIs, and it's talking about, the different terms, the word origins, the definition. And then here it's like, hey, be careful. And it talks about some different things you might need to know. And then ICD-10 CM notes. So they have all these little helpful notes within the book about how this section of med term and anatomy pertains to medical coding. So it talks about here how if a subsequent AMI occurs within 28 days of a previous AMI, a specific subsequent code is used. If a healed MI is seen on EKG, a code for old myocardial infarction is assigned. So they do that not only with ICD-10, but CPT and ICD-10 PCS, procedural coding system. So I cannot possibly recommend this book enough. It is just 110% phenomenal. Absolutely amazing. Let's see. Yeah, there's a lot going on in the chat today, you guys. And we have a high volume of people coming in, which is awesome. Oh my gosh, that's not the screen that I want. Boop, there we go. Yeah, so Christina's saying, and this is a very valid point, don't bog yourself down with A&P and terminology because the final is only coding. Now, some of the stuff in coding, it is a million times easier to understand and pass and get through that question faster if you know the anatomy, if you know your med term. But when we're talking about just isolated questions that are just med term on the exam, there's not actually a huge amount of them. So let me show you over here. If you go to certification and then you go to like your CPC, which you can't see because my face is in the way. But if you go down here at the very bottom, it tells you the exam breakdown. So a lot of it for the CPC exam is CPT coding. But there are some sections on here that are just on med term, but it's like 8 questions. 8 questions on anatomy, 8 questions on med term. So while they may throw some stuff in that you will be much better at answering if you know med term and anatomy, there's only really 16 total questions of the 150 that are just on them. And sometimes, like I said, you can kind of piece them together from what's in the book. I highly, highly, highly recommend med term anatomy and physiology. You can probably get away without it. As you progress though in medical coding, if you're looking to be in this for the long haul, into maybe getting into compliance or into auditing or into specialties, the more depth of knowledge you have on things like anatomy and physiology, so that when you're working with providers, communicating audit results, talking about complex surgeries, that will really benefit you in those situations. If you're someone who's just like, hey, I just want to work from home and code and be done in my 8 hours, you'll be fine with that. Yeah, I know cocktails and coding sounds great. One of these days, I don't know. I'm afraid, because I'm going to be honest with you guys. I am a huge lightweight. So my cocktail and coding would be like one shot and I'd be done, because then I'd start getting way too silly in here. Teresa, hey, haven't seen you in a while. So I love your videos. I'm thank you, Teresa. I really appreciate that sweet, sweet comment. I sure do. I surely do. Adarsh says, I am going to start my medical coding classes from June 15th. I feel like I need some music right now because I'm jamming out and there's no music on. Good luck to you. That's going to be so awesome. Starting June 15th. So let me know some more, like where you're going, how long is your course? Are you going through a college? Are you going through an instructor? Pace yourself. Like really make sure you focus on those first couple of chapters too, because you want to make sure you get that base knowledge good, right? Like your med term, your differences between the insurances, the business of healthcare. Like you want to make sure that you have that base knowledge down. It's kind of like if you think about back on math, like if you didn't understand your first couple of chapters of algebra, like the rest of the year, you were completely lost. So get that good base knowledge down. Hey, back to you, Diana. Good to have you here. Yeah, so if you go to emptysamples.com, they'll give you some sample notes, but they don't give you the codes because it's really just for medical transcription. So they're good to get a feel and practice. But as far as knowing you're selecting the right one, you really can't. There's no like rationale involved in them because that's kind of not the purpose of them. If you want, you could maybe hire a tutor and they could go through some cases with you though. Do you know if classes are ever offered by AAPC in a classroom or online only? That is an excellent question. So it just so happens when I took medical coding, I took it in a classroom. We haven't done that obviously in the past year and a half or so because of the pandemic. But yeah, there are a lot of instructors that I think are now starting to pick that up. It's probably in isolated areas. The instructors would probably have to have an agreement with an institution or have rented business space of their own to host classes. So you won't find them necessarily from the AAPC themselves, but through the instructors that they are licensed through. So I know I think Paul Chandler from Ohana do in-persons? And I know there's a couple of people in New York that do them as well, that they maybe have their own kind of business where they have seating to teach classes in person with the AAPC's official curriculum. So you can go through in-person classes. They'll likely start picking up within the next year, I think. When you pass the CPB, do they put an A to it like they do for the CPC or no? Sorry for asking so many questions. No, that's great. That's actually a great question. So there's only 2 certifications that the AAPC offers that they have the apprentice designation with, the CPC and the COC. And I think they have that on their information online. Let me check one quick thing. APC apprentice. So any other certifications that you get, you do not have to get the apprentice designation. So actually the certified inpatient coder, the certified risk adjustment coders, they have no A's. If you look here, I think it says it here. Let's take a look. To remove your apprentice designation, so it says about CPCAs. Does it say about COC? Yeah, it doesn't say it on this page. Maybe it says it here on the overview. No, it asked me to log in. But yeah, COC and CPC are the only ones that you have an apprentice designation. So it looks kind of odd when you get like a CPC and a CRC, because you'll have an apprentice designation for your professional coding, but not for your risk adjustment. I don't know personally, but I know that there's been talk about them wanting to get rid of the apprentice designation. So I'm thinking since CPC and COC have existed for a long time, they're kind of holding on to that apprentice designation, but the new credentials that they've come up with, maybe they're not doing them because they just don't now. But they still do for their much earlier credentials, the CPC and the COC, but those are the only 2. So you don't have an apprentice for the CPB. Again, as far as what their exact personal thought process on that is, I don't know on why that is, why it is. So yeah, so you're having a 3-month course, 3 months internship. That is awesome in India, Calder Valley. Yeah. So internship, that's going to be awesome. Oh, that sounds like a great program if you get an internship, because I was hired right off my internship. I got very, very lucky. Oh, Paula, I'm so jealous. I'm hoping I rescheduled my beach trip. I'm going to the New Jersey beach. One of them. I don't want to say exactly which one, but I'm going to beach out in New Jersey, hopefully in a couple of weeks again, since I missed my trip yesterday. Which is okay because it was going to be rainy and cold anyway. So hopefully, fingers crossed, when it's rescheduled now, it'll be sunny and warm. But have fun at the beach, Paula. I am obscenely jealous. Is the CPC harder than the CPC? I've heard some people say it's pretty tough. I haven't taken the CPB yet. I'm hoping to, because I have an exam voucher that expires in like November. But I've heard some people say that it's pretty tough. Even people that have worked in billing have said it's a pretty tough exam. But I personally haven't taken it, so I don't know. I couldn't tell you my personal comparison, but I have heard it's kind of tough. Victoria, are there medical dictionaries that you recommend? Medical dictionaries, I don't have a personal recommendation. Oh, if anyone has any recommendations on medical dictionaries, let me know in the chat. I know there is one that people tend to recommend. Off the top of my head, I can't think of what it is. I did have a medical dictionary when I studied medical coding. I think it was just like the Webster's Medical Dictionary. But since they don't permit them, Dorland's, that's it. Thank you, Whitney. That is exactly it. Everyone recommends the Dorland's version. That is a great one. But since you're not allowed to take it for the CPC exam, I didn't focus a lot on my medical coding or medical dictionary rather. But yeah, Dorland's, everyone says is a phenomenal medical dictionary. Thank you, Whitney, for popping in there with that. Really appreciate that. Mel is asking, do you know if the blue official CPC certificate study guide is the same questions as the ones you would buy on the AAPC for the online practice exam questions? So if you're asking like the book, I don't know if the ones that they have are different. This is my 2021, right? So they should be orange. I think they're blue from last year, maybe. So if you're asking like, are the questions that are in here the same as the practice exams? I do believe they are different. There might be a couple that are the same or similar, but the practice exams should be different from the ones in your study materials in either the books or the curriculums. Mary, this is a great question. What is your recommendation for studying HCC study guide, exam study guides? So, Mary, I don't know if you know this, Miss Mary. I'm gonna let you in on a secret. I think so. Here's my thing. So I think the study guide for the CRC is what you need to pass the CRC exam. I think that Risk Adjustment Documentation and Coding by Sherry Poe Bernard, the book, Medical Coding, Risk Adjustment Documentation and Coding by Sherry Poe Bernard. It's available by the AMA. You can buy it on Amazon. Phenomenal book for knowing all things risk adjustment. But if we're focusing on the exam, you want to get the CRC study guide. You want to get the practice exams. And if you're interested in self-studying and want some additional support, if you go to my website, contempocoding.com, I have a CRC review and practice exam, very, very affordable, $29.99. It is, I believe, 3 hours, 3 hours. Let me check. I think it's 3 hours. I don't want to misspeak. 3 hours of video, and it just goes over some of the really focused things that you need to know for the exam. There's exams test tips on the bottom. There is a practice exam that I custom built based off of the curriculum available as well. So if you're interested in self-studying, but you need a little something extra, I would love it if you consider purchasing that. But yeah, I think if you already know medical coding, to make that leap from professional coding to risk adjustment coding doesn't always require a lot. I do have a full course available though for everyone who wants to go through like really thoroughly all the material. Yeah, Marissa. So Marissa has taken her CPB. Marissa. She says that it's multiple choice and it's challenging. It has minimal coding in the exam and you will need to understand billing in depth and claim forms. Whew. That sounds intimidating. It sounds kind of intimidating. And it sounds like it's one of those things like you know it or you don't because you can't look them up. It's because if I remember correctly, let's actually take a look. What are the books that you're permitted to take for the CPB exam? I wonder if you're allowed to take your coding books. APC exam FAQs. I love going through these exam FAQs. Let's take a look here. APC exam FAQs. That's not the one I want. This is the one I want. So if we look at the exam FAQs, they tell you about what books you can use. And underneath there, what items will I need to bring? Here we go. Approved resources. So if you're ever curious about what you can or cannot take to a certain exam, this is what you want, their approved resources. So if you look at this here, it lists all the different books that you might be able to take for certain certifications. So if we look here for the CPB, we're allowed to book 200 questions. Holy crow, 200 questions is a lot. That's a lot. So you're allowed to bring references 1, 2, and 3. So you're allowed to bring the CPT book, Professional Edition AMA only, your choice of ICD-10 and the guidelines, and you're allowed to bring your HCPCS level 2 for the CPB. But yeah, so if you're ever curious about what you can or cannot bring as far as references for the exam that you're taking through the AAPC, this is your allowed reference material listing. It's on their exam FAQs and you can reference it here. So for example, if you look at the CRC, Certified Risk Adjustment Coder, you're allowed to bring book number 2, which is your choice of ICD-10 CM guidelines. Doris Lee, thank you for subscribing. I think some people get confused. If you just look at this in glance, you might think, oh, I'm allowed to bring like all of these books. Like I can bring the CPT, I can bring a reference of my choice, I can bring these crosswalks, but you're only allowed to bring the references that are listed here. So like Ambulatory Surgical Center, you can bring 1, 3, and 10. So reference 10 is, zooming around here, Reference 10 is one reference of your choice. This does allow a medical dictionary. So, but that's only for that specific exam. You're allowed to bring that. Cool stuff. Great questions we're getting today. Thank you, guys. Do I have the study guides for the CPC? Not available for sale. So I'm hoping to put a CPC curriculum together. I have to finish a bunch of stuff. I actually have some days marked out to record some more of the sessions this week. I'm still kind of weighing the options as far as, do I want to make it a set time? Do I want to make it's fully on demand and then I offer it for less? So still getting it together and figuring out what I want to do for it, because I'm going to be honest, I'm kind of thinking I want to gear more towards helping out new coders, but focusing really what I sell on coders that are looking for an advancement. They're looking to become auditors. They're looking to get another credential. They already have the base knowledge of coding, or even maybe some career support. So those are some things I really want to focus on as far as my business, and then focus the entry level stuff more on the YouTube channel, but still kind of want to have a CPC offering of some sort. So we'll see. But yeah, so if I can only sell the CPC study guides to students, because that's part of the agreement that I have with the AAPC. And since I'm not selling the courses right now, I can't sell the study guides. So Priyanka says, hey, Victoria, love from India. They say coding itself is much more difficult than the exam. Yeah. And we are yet still struggling with the exams only. Yeah. So when you finish the exam, there's this exhilaration, like, yeah, I did it. Woo! But you have to be very graceful with yourself in understanding that, in the real life world, you're not going to have multiple choice. The doctor is not going to put on his op report, it's A, B, C, or D, right? A lot of people get shocked then when they start Practicode, because it is more like real life coding versus just selecting something out of 4 options. So I really feel, you have to be kind to yourself. This is just like learning anything else. When you're learning a brand new language, you're not going to be fluent from it right at the get-go, but you can learn enough that you can go to that country and communicate, right? So that you're going to build up from there. So really just be graceful to yourself, honor where you're at. Say, I know the base of medical coding, but I have to grow from this foundation that I have now and really hone in on focusing on learning how to code as a real coder. So, a double question here. So someone else wants to know the same thing. Let's see here. My apologies if this was already asked. I'm worried I've written too much in my code books and I have my CPC exam next weekend. How much is too much? That's kind of a tough thing. There's a couple of things to think about with this. So number one is, a lot of proctors don't look as heavily maybe as they should be, and they're just going to look that you don't have post-its or tore out pages or white out. And then others might question some large or long passages of text. There isn't a hard and fast, it's not as black and white as you can have this but not have this. Now, as far as can you write a lot? Yes, but there are a couple of things that you can't write in your book. And what I can show you is if I just go back to the AAPC exam FAQs, and I can never find them on the website. So I'm going to be very honest. The way I always find these is I go into Google and type in AAPC exam FAQs, and the link will show up there. So if you look at the exam FAQs, it tells you here what is allowed in our books. And this is the guidance that the AAPC gives. It says you can have handwritten notes that are acceptable as they pertain to daily coding activities. But these are the things that you can't write in your book. Questions from the study guides, practice exams, or the exam itself are prohibited. So you can't write basically your study guide into your book. You can't write your practice exam questions into your book. You can't take the exam once, write the exam into your book, and then take it a second time. And then tabs. You can insert regular tabs. You can't use Post-it notes as tabs. You can't glue, staple, or paste anything in there. The one exception might be if you tore a page out or you tore a page in half and you need to tape it back up. That's acceptable as far as taping. Or with whiteout, they say you can't white out an entire page or alter your book heavily. But if you're writing in a note and you go, oh, I wrote that word in wrong, and you white it out and rewrite it, that's okay. What they're saying is you can't white out, your whole marketing page and supplement notes in there. So, as long as you're not breaking the rules as far as not writing huge passages of text where you're writing basically another book into your book, or you're writing your practice exam questions into your book, that you should be okay. But it really ultimately is going to be up to your proctor on that day to determine, what they kind of feel. Evelyn's saying, do you have to do Practicode after you pass the certification exam, or can you do this before? I've heard mixed things. I've heard some people say that they have started Practicode prior to their certification, and I've heard other people say they don't have access to it. It might depend maybe on what kind of package that you've gotten. But you could certainly attempt to, if you have access to it, you could certainly attempt to go in and start working through your Practicode. I'm going to take the CPC exam this month. What are the things I should focus more on when reviewing? So focus on the areas where you're struggling. So when you're going through your curriculum, like if you're going through the CPC curriculum, or if you're even going through with your program, like the step-by-step medical coding curriculum, do those practice scenarios that are in there. And if you're not doing so well on those practice scenarios, that might indicate that you need to reread that chapter, right? If you're doing okay, you can just go ahead, maybe you move on to the next chapter, but that'll give you a good indication like, hey, I'm not doing so well on cardiovascular. Hey, I'm not doing so well on lab and path. And those are the ones you need to focus more on when you're refreshing, and get those practice exams right between when you finish and when you're going to take your exam, so you can really assess where you are. Do I have suggestions for someone proctoring an exam for the first time? So it depends, first off, if you're first proctor or second proctor, because first proctor, you get the exam sent to you. The rules for proctoring are, if you're the first proctor and you have the exams, you're actually supposed to open up that box, see who all is coming, make sure that you have the right exam booklets before you go, right? Because you don't want to get there and find out that you're missing an exam booklet. So check those before you go. Make sure that you start on time, that you're strict with everyone, that once you've begun the exam, no one else is allowed in. Make sure that you're not just flipping through the books for loose pages, that you're checking to make sure that they didn't tape any extra pages in, that they didn't write their practice exam questions in their book. Now, if you're not vaccinated and you're feeling a little bit reluctant about wanting to touch or breathe near people, you can have them flip through the book for themselves and show you. And then keep an eye on the time, because they get a warning when like you got 30 minutes. And the other thing is just make sure that they're allowed the right references. So make sure that on the reference guide, if it says they're only allowed options 1, 2, and 3 of those books, that you can show them you are only allowed 1, 2, and 3, because people will show up. I've had students show up to the exam when I was proctoring, and they took like every book they ever had throughout their entire course curriculum in college. So they're there with their billing books, their insurance books, their study guides, their notes. And they're like, I don't know which of these am I allowed to have? So you have to tell them like, okay, well, here's where it says in the paper that you're allowed your ICD-10, you're allowed your CPT, you're allowed your HCPCS. And then be careful to make sure that with the CPT, they were only allowed the AMA Professional Edition. So you're in India, you have your master's in microbiology, and you learned basic coding through Udemy. Please suggest some books and tips on how I can give CPT exam. So I'm thinking you're talking the CPC exam, the medical coding exam. I have a great video on my channel on self-study tips that you might find helpful. So if you go over to Contempo Coding on YouTube and you go to the main page, there is a video that I have. It is called, where is it? Medical coding self-study options. And that might be a good one that you want to look at, because there's lots of stuff as far as self-studying. And then I have whole playlists on the website as well that you might find helpful in your self-study journey. Okay, so as far as PDFs, I cannot provide PDFs of books because that would be copyright infringement. So I don't want to go to jail for submitting copyright infringement, because I want to give you books for free. So unfortunately, as much as I sympathize with that, it's not something my hands are kind of tied. I don't have the rights to give PDFs to any of the books. Christine's asking, can you write down specific page numbers, like where to look for guidelines? Yeah, you can absolutely do that. Especially in things like want to write down even illustrations. Like if you're looking in your ICD-10-CM book and you want to know that in your CPT book, the cardiovascular picture of the heart is on a certain page, yeah, you can write down certain page numbers and guidelines. If you're interested in methodology, there's 2 methods that you can look at. There's BAT, which is bubble, highlight, anoint technique. And then there's CHUN, the circle, highlight, underline, and notate. So if you go to cco.us, they're a great resource. I've even done training with them in the past. I'll fully say that. cco.us has a way that you can access their techniques of how you highlight the books. And there are coders that absolutely 110% swear by that. There are some coders that say, yeah, I absolutely needed that for the exam. It can be very helpful, the exam. Maybe not so much year after year. I know some people that are like still so adamant about, I write my notes and I highlight this. And I personally don't have like 40 hours to dedicate every year to rewriting notes and stuff in my book. I always say I would love so much if they just sold a digital version. Like I have my digital CPT, but if I like highlighted and notated that and every year just updated the new codes and kept all my highlights and notate, like that would be the best thing ever, right? Like then I might actually switch from a paper book to fully digital. I have both right now. I have the digital CPT book and I have the paper book. Can you tell us how we purchase the books? Which is the best one? Check the video that I have because I have links in the description of the video as far as book recommendations and stuff. Oh my gosh, it's 3:05. I'm going to keep going because we got some questions on here and I'm going to keep going for a little bit because I have so many questions coming in and I really want to be helpful to you guys. I plan to take the CPC in July. Are there any other resources to use? Because I noticed the practice exam is costly. So yeah, if you go right on the AAPC website, those can be, if you buy one of the bundles, more expensive. Sometimes you can find people that have them on eBay or Etsy. I have a review course on my website that's $29.99 if that's maybe something you're looking for. And the review course does include practice exams in it. So not only do you get 8 hours of review, but you also get some practice exams in there as well, contempocoding.com. How much is the difference between renewal and new registration fee? And if I get canceled in my area due to COVID lockdown, do we need to pay the cancellation charge? That's a question you have to ask the AAPC. So as far as your registration fee, so you have to pay to become a member of the AAPC. You have to pay to take the exam. And I'm not sure what they're doing because it sounds like you might be an AAPC Global. So they sometimes have different regulations than just general AAPC. So you'd have to talk to AAPC directly as far as what their cancellation policies and reschedule fees are right now. So I don't know what you do in India as far as proctoring, because it kind of sounds like you go to exam centers. In the United States, what we do is the exams are administered by local chapters, and we utilize chapter officers and volunteers to proctor the exams in an area that they've borrowed, usually a hospital or a school. So since they're not done at the exam centers, the proctoring is done by officers and members. So there's no test or anything in the United States to become a proctor. That might be different in India. It sounds kind of like, and again, I've not been there, so I don't personally know, but it sounds like you guys might be using exam centers. Job search in the US. So I don't have a lot of tips from if you are external, like outside of the US and applying for jobs in the US. The only resource that I tend to refer to is the typical ones that are domestically used, Indeed.com. And then the other one is codersdirect.com. You might be able to find something there. So if you check on codersdirect.com, this is a listing of jobs specifically for medical billers, coders, auditors, HIM professionals. So it's again, codersdirect.com, codersdirect.com. And you can search here if you're looking for ones that you can work remotely. You can work remote. You can find jobs that are based off of just your credential. So if you were looking for a job just for CPCs remote, you can search there. or you can go through all of your listings. You can also post your resume here for employers to find you. Also check the video that I recently did with Kyle. He talks about some of the ways you can connect on LinkedIn to find jobs. Thank you, Patty Tucker. Yeah, so this is my caffeine mug. It's my Beaker coffee mug. Kelly's asking, Keller Dean is asking, why do you use both the paper and digital books? So I do for the CPT. Reason being is I like the feel of my paper books. I like searching through my paper books. I find it easier, but I also have them on my Kindle so that if I'm not at my desk, I can, as I'm working maybe on my couch or something, I can pull out my Kindle or pull out my laptop and view them there. Also, there are some people that are instructors that will show the digital version. And I wanted to kind of play around with that. But for some reason, I just don't like the way it looks as much for some reason through Amazon Kindle. And I don't know if maybe I've seen some people, and I don't think they're allowed to do this, but it looks like almost scanned in their CPT book so that they can share it with people. Because I can kind of tell the way it looks more like a scan versus an actual digital copy that they're kind of demonstrating on. So that's why I have it, so that I have it in those two formats. It's easier to kind of use on the go, the digital version. So Priyanka, I would love if you could elaborate this for me, because I've gotten asked this quite a bit as far as age limits for taking the CPC exam. And I'm just genuinely curious. In the United States, we don't tell people that they can't do a job after a certain age. So I don't know if maybe in your country there are certain age limits. Like if you want to get into a certain career, you have to be under a certain age. So in the United States, I don't believe there is. I can't speak for AAPC Global, but I would kind of love to know if there's age limits in your country as far as certain career paths that they're not allowed to do them after a certain age, because I'm just genuinely curious, because that's not a concept that it kind of exists in my country. So Cinderella is saying, I am looking into changing my career to medical billing and coding, and it's been on my mind for a very long time. Where do you suggest I start? So check your local career programs and local community colleges. They often have some great resources available for you, some great programs. They can offer you things like financial aid. They can offer you sometimes, local discounts that because you are local, they'll give you a lesser fee than someone who's coming in from out of state. You can also check, I have an agreement or a partnership with onlinedegree.com. So if you go to onlinedegree.com/contempo, it's in the description of the video. They will offer a discounted fee or some other bonuses to the people that sign up with my registration link. So that's a resource you can use. Sometimes they will help you find a good path for you in the right program for your needs. Like how long are you able to commit in a week? Do you need something online? Do you need something in person? And they kind of match you up based off of your criteria. Hey, Kimberly, good to see you in here. I'm running long today. I usually only go till about 3:00, but I have so many questions coming in. I thought it would be great to hang out for a little while. So Latrice says, I graduated last year and my school will pay for 2 times to take the test. Will I have to contact them first and get the code to pay for the exams? That really depends on your school. So I know some schools, they'll offer different exams. So be careful with those exams, because sometimes they have a partnership with certain organizations to offer exams through them. But most organizations are looking to hire coders that have credentials through either a HEMA or AAPC. So not saying don't take those other credentials, but focus really on getting a credential through AAPC or a HEMA. So yeah, contact your school and find out what those details are on what they do and do not offer. What other questions did I have come in? Because I know I missed a few in here. Oh, so the other thing, and if anyone has any tips on this, definitely let me know, because I may have said this earlier, but I want to reiterate because I knew some new people came in. I'm looking to find someone who successfully made the transition from biller to coder and is willing to come and do an interview with me, like a video interview, either via Zoom or maybe on the podcast or on the live stream to just kind of talk to some of my audience that's looking to make that billing to coding transition. So I'm not seeing any more questions come in right now, but I'm going to be back next week. And I think I'm going to do that. I think I'm going to have some questions and answers and games and giveaways to celebrate what will likely be my 25,000 subscribers. So that's what I'm hoping to hit. Where are we at right now? Guys, let me know in the chat. Where are we at right now as far as my subscriber count? I think it is like just shy of 25,000, right? And I usually gain about like 90 subs a day. We are currently sitting at, it looks like 24,843 I'm showing. So that's exciting. One last question before I go. Brittany says, I took a medical billing program with CPT and ICD-10-CM through my community college, but they don't offer any exams. I don't feel prepared for the exam. What can I do? Look for your local chapters, your AAPC local chapters. They might offer review classes. Some of them offer them. I've seen some chapters offer review classes for the CPC credential for free. I've seen some of them do it for pretty cheap, $20, $30, $50 if they're using maybe multiple instructors and have a really good program. Look for that. You could take a review class through the AAPC. They offer I believe they do offer an on-demand review. I have an on-demand review that comes with a practice exam if that's something you're interested in, or if you have a preferred vendor that you know. The other thing to consider is CCO.us has a Blitz program that is kind of somewhere in between like a full course and a review. So if you think you need a little bit more than a review, that might be something to look into as well. Thank you, Teresa Marvel, for subscribing to the channel. I appreciate that. Where can I find the chapter for review classes? You know what? That was a fantastic question. I am really glad you asked that. So if you go onto the AAPC website, this is how you find local chapters. So it is under networking. Let me get my face on the other side so you can see what I'm doing. Networking. And then you go to find a chapter. So networking, local chapters, find a chapter, and you can search by your state. Or the other thing you can do is over here, it says list all chapters. So if you're in, for example, California, here's all your chapters in California. So you can check if you're maybe in Chino Halls, you can check the details here and it'll list all the different events that are going on at Chino Halls. Apparently they're not having anything right now. Let's see one that's a little bit more fuller. Sacramento. I think they have chapter reviews there. So they have a meeting coming up on social determinants of health, and then they have a couple of exam dates on there. So if they were having a local chapter review, it would be listed here as well. I think there might be, I don't think there's a way to check them through the chapters. Yeah. But yeah, you can check and see if any of your local chapters are hosting reviews on the AAPC website. So that's how you find them. You go to networking, go to find a chapter, and you can find all your local chapters. When you become an AAPC member, they basically assign you a local chapter based off of where you are closest to. You can change your local chapter designation. So if you're someone who maybe works at a different location and it's closer to a different chapter, you can change your chapter designation to closer to where you work so that you can commute back and forth there, and that's easier. Will I be at HealthCon? So I'm not going to be at regionals. I believe I think they might be close to capacity. I think they might only have a few spots left. I'll probably be attending regional virtually, but I will be at HealthCon Nationals in DC next spring, which I believe is either March or April, which I'm excited about because even though I'm disappointed it won't be at Disney this year, which I was really hoping for because I love Disney. I've always wanted to see the cherry blossoms in DC, and I think HealthCon is happening right around when it's like cherry blossom time. So yeah, I am going to be at HealthCon next year for sure. Absolutely 110%. So anyway, I am now 18 minutes over time. I want to thank you all so much for coming in and spending some time with me today. I am just so excited every week to come in and have time with you guys. So next week, I'm going to be back at 2 o'clock. I might run a longer stream if enough people come in, but I'm going to be back next week. Let's say that, let's put it in there. I'm going to do questions, and we're going to have some giveaways next week because as long as I hit 25,000 subscribers between now and then, I'm going to give away some t-shirts. I'm going to give away a copy of, since you guys thought this was so fun, the anatomy coloring book. And I'll have more details coming out. I'll post some stuff on social. I will see you guys next week. Thank you for coming in. And until then, you guys just keep on coding on.